A UT Health associate clinical professor becomes a patient undergoing an innovative procedure to cure himself of a rare type of cancer. Eyewitness News reporter Jeremy Baker shares his story in tonight's Wear the Gown.
Dr. David Miramontes is also the medical director for the San Antonio Fire Department. When he started coughing up blood 3 years ago, he knew something was terribly wrong.
And I'm going, oh boy, this is something big. I got a blood clot, I got an abscess, I got an infection, or I have cancer.
The type of cancer, laryngeal chondrosarcoma. In most cases, the entire larynx, your voice box, needs to be removed. As a teaching physician, that news was devastating. He would never be able to talk again.
We went to MD Anderson and they said, oh, we'll do the laryngectomy. We'll take everything out. We'll do it next week. And we're going like, time out.
Eventually, a colleague directed him to Dr. Mark Corey from the Mount Sinai Health System in New York City. That's where he found out he wouldn't have to live with a trach for the rest of his life, and his voice would stay too.
Wrap the rib graft in a piece of vascularized tissue that they get from the thigh of the patient. And when you wrap the rib graft in that vascularized tissue, the rib survives, and you can use it to reconstruct the support for the back part of the larynx.
Some of the main symptoms of laryngeal cancer include a change in your voice, such as sounding hoarse, pain or difficulty swallowing, a lump or swelling in your neck, a long-lasting cough, and in severe cases, difficulty breathing. Several procedures, and 3 years later, Dr. Miramontes is cancer-free. And he has that second chance to do what he loves.
My type of cancer let me do something very innovative, something very weird, and let me go back to work. And it's just a blessing that I'm able to do that.
Jeremy Baker, KENS 5 Eyewitness News.
For more information on family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just go to wearthegown.com.